In Embu County, the Vision Impact Project, VIP, for Inclusive Eye Health is more than just a program. It's a life changer with one core objective: to reduce visual impairment and prevent avoidable blindness. VIP is delivering quality eye health services to those who need it most, with a deep focus on equity and inclusion.
In 2020 all through 2021, CBM embarked on a program which was quite ambitious. The main goal was to work towards reducing prevalence of visual impairment and avoidable blindness. And this was envisaged to be made possible through system strengthening, that is, eye health system strengthening in the country.
Now, the Vision Impact Project main purpose was to end the prevalence of avoidable blindness, and through that then our work was to kind of work with the county governments of Embu in partnership with the Christian Blind Mission to make sure that we work with them and the communities to provide them the eye care they need.
Previously, Embu County faced significant challenges: inadequate infrastructure, insufficient resources, low service uptake, and weak health systems hindered effective eye health service delivery.
Eye health in Embu actually for a long time has been one of the areas that has been neglected until 2021, when actually this project, the Vision Impact project, came on board. Before then, we used to have quite a number of issues with primary eye care services in Embu. We only used to have level 5, where we used to have a tiny office where we used to do all the coordination of eye care services. But again, we never used to have major services. Actually, quite a number of services used to be dispensed outside Embu County.
Back then, before the Vision Impact Project, there were very few eye care workers. Actually, there were less than 10, about 6 or so. And these ones were supposed to serve the entire Embu County. According to standards, that is too low.
In a world where many still live in avoidable darkness, the Vision Impact Project, a partnership between the Fred Hollows Foundation and CBM, is bringing light, dignity, and opportunity back into people's lives.
Wakinyire ndatuga guthie ngakoragwo ni ndirarigwo ni kuria ndirathie ndatuga guthie ngora ndathie kwa mwari wa maitũ cio ngiuma gwake ngarigwo ni gwakwa koguo niguo ndamenyire maitho ni mora na ndirĩ na wa gwĩka.
Shida yangu ilikuwa ya macho. Nilikuwa nakula tabu sana saa ile nasoma. Kwanza kuweka credit kwa simu ni shida.
There was a certain case of a certain mid-ranged man who always thought that he had both eyes, but on screening he just noticed that he was using one eye, and he had a cataract. I explained to him that cataracts can be reconstructed, which he didn't know at that time. He thought maybe with the loss of the eye it was final. I booked him for the treatment day, where he was further booked for the surgery, and that eye that could not see can see now.
At its core, the Vision Impact Project is about people, with the Fred Hollows Foundation driving eye health solutions and CBM ensuring no one is left behind. This collaboration is transforming lives and communities, one restored vision at a time.
Broadly, the Vision Impact Project, we are approaching it in two ways. One of the ways is the community approach, where we are moving to the community to give services from screening to treatment. That is one of the approach. The other approach we are having is a school approach. Now, instead of moving to the community, we are moving to the school, where we are doing the screening and the treatment at school level, giving the eye services to the school community. Those are now the runners, the teaching staffs, the non-teaching staff, anybody in that school.
There are various activities that goes around in this project. That one is to identify primary eye problems. Second one is treatment and provision of spectacles. The key one is, under KSB is rehabilitation, where we identify people with a visual impairment, where we rehabilitate them on how to go up with their daily activities. And another activity is provision of white cane that help them for doing their daily activities without any difficulties.
It's not just one thing, it's everything. The Vision Impact Project blends stronger health systems, peak technology, active outreach, and schools integration to make eye health work for everyone.
PIC as a technology is a very good thing that happened in Embu County. The screeners usually takes very few minutes to screen and identify and even refer patients that are found to have eye conditions. The other thing that PIC has enabled is data evidence for decision making. You see, initially data was being done manually, if at all it was there, but currently you find that if data is needed for any kind of decision, we can just go to PIC platform and get that data.
The community eye care worker is able to identify the challenges that a would-be patient is having and then appropriately refer them based on the measures that are and the guidelines that have been provided. And the beautiful bit about the technology is that it does not require an ophthalmologist to use it. You just need the ordinary person, that is a teacher, a community health volunteer. Either to that, before then you'll need an ophthalmologist who is highly trained for many years. He or she has spent years in the university or colleges. Therefore, kind of task sharing and shifting to lower level cadre so that we can optimize our utilization. So there is where the use of technology becomes useful.
The impact is undeniable. VIP has achieved significant milestones. 241,661 community members screened, 128,336 school children screened, 866 cataract surgeries performed. These aren't just statistics. They're stories of hope, of children seeing the blackboard clearly for the first time, of parents returning to work, of lives once dim, now full of possibility.
Kimasomo mbeleni ilikuwa down kidogo na saa hii imeinuka, iko sawa kabisa. Juu hizi specs hata nikifanya mtihani I am using. Na mbeleni siku naona vizuri huko penye nasoma mtihani.
Nimepata msaada ya hii Google ya kusoma. Itanisaidia sana kusoma Biblia hata vitabu zingine.
A good number of people were living not knowing whether they have eye conditions. And after initiation of this program, people they are able to know they have eye problems, they are treated, and they are able to carry out their daily activity comfortably.
If we are able to do about 600 cataract surgeries, that means that you've been able to make about 600 IC. In
2023, we identified through the project a family of four children, that 3 of them had cataract in both eyes. They got identified, got into the system, the project system, and the project facilitated them to go to have cataract surgeries at Sabatia. Initially, before they went for the surgeries, the children or the kids were really dull, and they seemed not to have like good life even when they were going to school. From the stories that were being given is that they were being even escorted to schools. Even their teacher learning was not an easy thing. They faced challenges in the schools, but after the surgeries, things changed and they became more lively. So from that, I feel it created a lot of impact on those children, and I know there are so many others.
Those who are basically blind and cannot have any interventions, we also had a project on rehabilitation. So what we were doing in this particular project is basically to give them a new life by taking them through some rehabilitation process, whereby those who are completely blind are able to continue with their daily living activities with minimum assistance.
It is important for us to also underscore the fact that VIP, upon training our teachers, they train them on how to avoid some of the challenges that can lead into eye care problem, that is cleanliness, maintenance of nerve lighting and so on. Apart from screening, they also do preventive measures.
Since the Vision Impact Project was rolled out in Embu County, that is in 2021, we have seen quite a big impact in the community since it's been able to bring the services closer to the communities.
I had an opportunity to spend a day with 2 community health promoters doing screening, but also to do some follow-up of cases that were supported. I could find and relate with an old person, a grandfather for this, who was able to get their treatment through VIP, and therefore currently they are able to lead their unneeded life. Before they needed people to walk them around and show them around, but now you are able to find them doing their daily chores of their age and being able to read their Bible, do things that they care so much about. And for me, that is quite important. That in itself shows when you give somebody sight back, you give them the independency that they really much needed. So sight is very personal in the sense that when you are blind, you depend on your life for people to show that, and people getting back their independence is very important.
The Vision Impact Project is not just a short-term intervention. It's about building a sustainable eye health system for the future of Embu County. By strengthening local capacity, fostering community ownership, and enhancing intersectoral collaboration, this project is creating a lasting legacy of improved vision and transformed lives.
In our annual development plan, we have set aside 5 million, which is the first ever to be allocated for eye care services, specifically for eye care services. And that way, it will go along ensuring that the gains that we have realized with our partners, we will be able to sustain in Embu County and progress on resourcing eye care services in Embu. And as we progress, of course, we will keep improving the allocation so that we can achieve the objective of having now total devolved eye care services.
As a department, when we co-create programs with our partners, we have never lost foresight that these programs are temporary. But whatever gains that we need and get must be sustained for the benefit of our people of Embu County.
Through the Fred Hollows Foundation, I know they have trained our people, they have trained our teachers. We will be having a lot of teachers who are capable of identifying the eye care challenges. We will be having a lot of children who have also known, and by the way, once children are taught on how to manage cleanliness, especially targeted at mitigating eye care challenges, they normally tell the others. So that is sustainability in itself.
Together, we're not just restoring sight. We're building a future where every eye can see its full potential. We are transforming today to shape tomorrow.
The moment you lose your eye, I think you lose everything. With the construction and the process that we are doing, I think it's big impact. It's only when you enter into the community you know how thankful they are for what we are doing.
I would take this opportunity really to thank the Fred Hollows Foundation and the Vision Impact Program, and also the CBM for that partnership. This partnership has been one that will be remembered for a long time.